Today what I wanted to do was talk a little bit about the interview structure. There's a lot of misconceptions about the interview, and part of it is because a lot of people, especially those that have trained in the UK, do their foundation years, Foundation 1, Foundation 2, maybe even an F3 or an F4, and don't have much experience of histopathology. Their knowledge and experience of histopathology is limited to, say, a taste a week or a little experience in the lab. What I wanted to do was kind of talk through the interview, what you need to know. One of the big questions is often, how much histopathology do I actually need to know for the interview? We will go through that in this video because there is some pathology knowledge you need to know, but it's not about the amount of depth. And I know it's a little bit scary because you know that some people are applying from abroad that might have a lot of experience or might even be consultants in their specialty. So you want to make sure that you use your time as effectively as possible to communicate what you do know in the most effective way possible to score those maximum points. Let's get into it. The interview consists of 2 stations. Each station lasts about 15 minutes. You might start on station 1 and then have a small break and then do station 2 afterwards, or you might start on station 2, have a little break and then do station 1 afterwards. The interviewers that do station 1 and station 2 are different interviewers. Typically there is 2 interviewers per station. Now the content has largely stayed the same in terms of, over the last few years, the kinds of questions that they ask. The emphasis has changed a little bit. So for example, the image interpretation station has much less time available to it now than it did previously. So for station 1, it's a 15-minute station, as is station 2. It starts with the image interpretation station, which is going to be 4 minutes long. Then you're going to have a discussion about histopathology as a career, which is 5 minutes long. And then you have a case study, which is for 6 minutes. So what comes up in each station? It starts with the image interpretation. And this is probably the part that people find the most intimidating. What happens is that you're shown an image on the screen. It has not in the past been a histopathology related image. It's not a histological slide, which is often the question that we're asked. It's usually some sort of drawing, painting, or an abstract piece of art. And then you're given a bit of time to have a look at it, and then you're just told to begin describing when you feel ready to do so. So what we recommend is kind of having a systematic approach for interpreting the image. And if you want kind of details on how we go about it, what we recommend, you can have a look on Smartly. 2 years ago, after that, you were asked to give an interpretation of the image and give an overall conclusion about how the image made you feel. Last year, those subsequent questions were not as heavily emphasized, and some people were not asked to give an overall interpretation. We would recommend, at the end of your description of the image, giving an overall summary of what the image is showing and possibly the sorts of feelings it evokes. And the reason we say that is it gives an overall impression for what you think the image is trying to represent. And that's ultimately what histopathologists do. They look at slides, they describe what they can see, and after the description, they give an overall impression of what they think the diagnosis is. They give it a label, they give it a title. In this case, you're giving it a label or an interpretation, and it's the same sort of process. You're showing that ability to analyze image and interpret and make logical conclusions from there. So the second question is about histopathology as a career. 2 years ago, this question had a time of around 10 minutes. It's now halved across the 2 years. What kind of questions come up in this part of the interview? Essentially, it's understanding the overall lab. So who works in the lab? How do they work together as a team? Who are the leaders? What are the contributions histopathology has to the medical profession as a whole? What are the challenges that we experience in histopathology? What new things come up in histopathology? So it's understanding various factors that contribute to histopathology as a specialty. In this part of the interview, there may be some technical questions about histopathology as a whole. For example, what is grading? What is staging? Just understanding some of the basic terms histopathologists use. Again, it's something we do cover in the Smartly curriculum, and where we try to define the key terms that you should be aware of so that you can answer these sorts of questions effectively. For the third part of the station, historically was a station where they discussed clinical cases. It could be a symptom and you discuss the sorts of things that you might expect in that presentation, what kind of symptoms the patient might have, the signs, investigations you would perform to investigate, and how the patient may be managed. In recent years, it has changed a little bit to put it more in a histopathology context. So for example, you may be shown a report of a particular diagnosis and you give your interpretation of the report, you discuss the key findings, what is the nature of the histopathology report, what information should be included in a histopathology report. So that's the kind of shift that we've seen in recent years, and I would expect that to continue this year, where the clinical knowledge scenario is much less heavily focused on the sort of typical clinical knowledge that you use in your day-to-day clinical work, and more related to a histopathology context. Station 2 then moves on to discussing team working and the MDT for 5 minutes. There are then 4 minutes to discuss a clinical scenario or a case study. And then finally, the interview ends with 6 minutes of discussion around clinical error and audit. Okay, so what comes up in each of those questions? In terms of the team working and the MDT, the focus there is about, it might be in part about yourself, experiences you've had working in a team, but then it's also going to be thinking about histopathologists and their role within the MDT. And of course, there's a little bit of overlap with that, with understanding histopathology as a career, but this is slightly different. So for example, you might be given a scenario, a challenging scenario where, say, a member of staff has called in sick for the histopathology department, and how do you manage that absence? That's the sort of thing that might come up. Or you might be asked to discuss how the histopathologist contributes to the overall multidisciplinary team. Okay, so then you move on to the case study, and this is where you might be shown, for example, an autopsy report, and you have to read it, synthesize the information, give your impression of the cause of death, and then you may be asked follow-up questions. So say, for example, you identify the cause of death as pulmonary edema. You would then discuss the causes of pulmonary edema, the pathophysiology behind that disease process, and you would, there might be follow-up questions on that, risk factors for the disease, etc. What type of patients get this disease, the demographics, the past medical history. So finally, you discuss the clinical error and audit station. And this is all about understanding the nature of clinical errors, the problems that they cause, what might happen if a clinical error arises, the impact that has on patients, and it may be put into a context, or you may just be asked questions about the process. Finally, it's understanding the audit process, the research process, and how that contributes to clinical care. Those are the two stations. For each station, you're also given an overall impression score, and that's about you as a candidate, how you communicate, how confident you seem, those sorts of things. They contribute to a global score, and you get a global score for your station 1 and a global score for your station 2. I hope you found that informative. I hope it demystified the interview process a little bit. If you feel that you need any further guidance in terms of the content that comes up, Smartly has a very thorough breakdown of everything you need to know for the interview as far as we're concerned. And we also do mock interviews where we can provide you with written feedback for your interview performance, and we score you based off of those domains. So if that's something of interest, please do subscribe, please do join. We are happy to help. It's all pathology trainees that do the interviews. And if you're not using Smartly and you have any questions about the process, please feel free to email us or WhatsApp us on the number provided on our website. Otherwise, we wish you the best of luck with the histopathology application and your interviews. Take care.